Hi, Alexis. Today
Hi,
we
good
have
morning.
welcome and thank you for joining us. We are here today. I'm going to just introduce to our audience who you are, and then we can go into interviewing you. So Alexis Freddy B is a Christian sexologist, sorry, and mental health therapist committed to helping women of faith reclaim intimacy, deep connection, and embrace sexuality as a God-given gift. Alexis holds a Bachelor of Arts in Psychology and Sociology from Bloomsburg University, a Master of Arts in Community Psychology and Social Change from Pennsylvania State University, and a Master of Educations in Human Sexuality Studies from Widener University. Her multidisciplinary training informs her holistic, culturally conscious approach to coaching, curriculum development, and community engagement. Whether through coaching, workshops, or content creation, Alexis brings a refreshing, relatable voice to conversations often shrouded in shame. Her mission is clear: to create safe spaces where women can be spiritually grounded, sexually confident, and fully themselves. Wow. Thank you. Thank you, Alexis, for being here and
Thank
welcome.
you for having me. Thank you for having me.
Yeah, we are excited to get this going. So tell us the journey that brought you to be a sexologist. How did this all happen?
Well, I've always enjoyed sexuality. I've always felt comfortable talking about sexuality. I've always been curious about the different areas of sexuality. And I just thought it was just like a thing. So I never knew that it was something that I could actually receive a degree in and actually help people. And I'm guessing like as a child, growing up in a Christian household, um, and going to a conservative Christian church, I was taught purity culture, and I was taught that like sex was this thing you just don't talk about, and gender roles and all the things were just so very rigid. um and I guess it was a little bit of rebellion in me that was just like, no, something doesn't, I don't like this. So it wasn't until I graduated with my first master's that I even realized, it was years after actually that I realized that I could get a degree in human sexuality, and I can actually, receive the education and be paid to talk about the things that I'm talking about so freely. So I was like, while I don't want to go back to school after a decade of being out of school, it's the thing. And then specifically to Christian sexology, which is not something that originally I wanted to do. I've never heard of Christian sexologists. So it wasn't something I was looking to consider like a specificity. So I prayed about it, and I was just like, okay, God, okay. Yeah, so that's how I specifically became a Christian sexologist.
Okay, okay. That's good to know. But you can, but also serve other people who, if they seek you out as not being faith-based or oriented, and who are just interested in the kind of work you do, they can still use your expertise, correct?
Absolutely. So being a Christian sexologist does not limit me
Hmm.
to only working with those who also identify as Christians. It is specific to purity culture and different things that were taught within the Christian faith, and a lot of other religions as well. But one thing that is universal as a society around sexuality and sex in general is shame and guilt. And
Hmm.
that's something that I can address with anyone. Something else that is also universal is just sexual reproduction and hygiene. So
Mm-hmm.
you have a body, and how to care for that body and what you should do with that body doesn't necessarily only align with the faith.
Mm-hmm.
So if someone is in need of education, I write curriculums. Um, I do speaking engagements, I teach. So again, just if you were to seek out a Christian counselor, it doesn't mean that they can only serve Christians. But it does mean that they do have they do use a framework for those specific clients if someone wanted to dig deeper and make the connection between the Bible and their body.
Okay, cool. Good to know. Thank you. Thank you.
Mhm.
So yes, so I think you briefly touched on this, where how is your practice different from others, or how do you practice that in a way that is there are other sexologists versus you? What would distinguish you, separate?
For me specifically, and I'll just speak for myself, having a large network because the sexology field, as you can imagine, is very small. So we all know each other. So some of my closest colleagues have completely different beliefs than I do, and that is absolutely fine. Because one thing that we really hold up a standard of making sure that we have a caring for people first. So whatever you need, we're not using it personally. If you're not the client for me, I can definitely refer out. I know people that are in everything. So
Uh-huh.
whatever you may be into or whatever you may go, I have a sexologist for you, and vice versa. I've been referred clients from some of my colleagues who are like, oh, this person may have left the church, but after sitting with them, they're dealing with still some of that guilt and shame around purity culture. And so maybe they need to sort of work out this, or do you have any insight? Can you help me with this, so that I can try to help this client with a breakthrough, even though they may have left and no longer identify as someone who is participating in the faith.
I see. Okay. Okay. Good to know. So I'm a pelvic floor physical therapist, and how our paths can overlap in terms of treatment with the musculoskeletal side of things, which I do, would be some of the diagnoses like dyspareunia, which is painful sexual intercourse, vaginismus, and vulvodynia, and all these have their medical basis, but there is a big psychological basis of that as well. So I want you to talk to the audience and let us know how patients would benefit if I was to send a patient who has dyspareunia to you or painful sexual intercourse. What would be your approach? What would that look like if they come to you?
Absolutely. So a lot of the times what I've seen in my time in the field is when we're given this sort of script that our bodies are supposed to automatically respond a certain way to arousal and to sex. And when that doesn't happen, it causes a cognitive dissonance. And then from that, then again, what comes? Guilt and shame. And then that just can intensify the physical symptoms that are going on because we know that the mind and the body are all connected.
Mhm.
So one thing that working along with pelvic floor doctors such as yourself, which is wonderful, like the work you do is amazing. But being able to connect that also to, okay, while you are working through these physical things that are going on for you, how can you continue or how can you build and or manage and maintain intimacy and truly understanding what intimacy entails, that it's not just sexual intimacy. There are 11 other types of intimacy that one can experience with themselves or with a partner. And how that also is, if not more important, just as important as the sexual intimacy that people are going through. And to sit with someone and let them know your body is not broken. This is something that you can work through. And while you're working through this, let's also work on the other areas of sexuality with just not intimacy, But when we're also talking about gender identity, how do you feel about yourself that now that you're going through this thing? Is this affecting your self-esteem, your self-worth? That's all a part of sexuality. And so
Mhm.
being able to sit with a client and really coach and go through those things and really weave out and work through, okay, while you're working on this physical thing, let's also work on this mental and emotional part of it as well.
Yes. Okay. 11 types of intimacy. I didn't know that.
There's 12 types of
Oh,
intimacy. Yes.
excuse me. 12.
Sexual intimacy is only one. So if that one is not for you, there's 11 other types we can be working on.
Would you state them for us? I don't know what they would be.
So off the top of my head, there's sexual intimacy, emotional intimacy, there's intellectual intimacy, there's spiritual intimacy, there's
Mhm.
conflict intimacy, there's financial intimacy, and the list goes on.
Oh my
So
gosh.
there are
Yeah.
a lot of different types of intimacy because intimacy usually more than likely is misused. When we think of intimacy, we only think of sex, and that is only one out of
Mm-hmm.
the 12. There are, like I said, 11 other types of intimacy, and intimacy only means connectedness. How connected do you feel to someone else, which entails trust and vulnerability.
Mm-hmm.
So you can trust and be vulnerable with people that you are not having sex with, and you
Mm-hmm.
can have sex with people who you do not trust or like.
Mm-hmm.
So they do not always intertwine and intersect. So it's important to and that's one of the foundations that I really work on is intimacy because a lot of people have a misconstrued idea of what that really means and what it may mean for them.
Yes, yes. Interesting, very interesting. So when patients come to you, how long can you expect to see them, or what's like the duration that they would be seen by you, and what can they expect there?
It's really a case by case basis. I am more solution focused. So I am the one that's giving out a lot of homework. I am the one holding you accountable. If you are seeing me, we are doing some work.
Mm-hmm.
Because that means you're in a place where you're truly wanting some change and you're wanting some movement in your life, and you're feeling stuck, and no one wants to stay there long. So it is my goal to partner alongside with my clients and how can we assess what's going on? How can we formulate a goal? How can we conceptualize how we can get from the issue to the goal and what needs to be done in order to get there. And for some clients, again, it's as simple as maybe not knowing, so not being aware of what is available to them or what is out there when it comes to maybe kink or sex or different types of behaviors, those things. And for some people, it is a little deeper when they are dealing with guilt and shame around either sexual identity, sexual orientation, or just sex in general. So it really depends, a case by case basis, what we're working on.
So would you do like once a week sessions, or is that also case by case as needed, or twice a week, or?
It's case by case, but usually I'm seeing clients maybe bi-weekly or once a week, depending on what the issue may be. Again, if it's couples coaching, which usually if you are coupled, I do highly recommend because it doesn't benefit one to have the tools and have to sort of try to influence or drag the other one along. Um, because I have a degree in this, so they may perceive it different. Because one thing I love is when I'm talking to clients and then they say, "Oh, well, I told my spouse da 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 da," and it's like, "Oh, that's not what I even said."
I think it's lost in the translation. Yes, can
Like, I'm
happen.
like, absolutely not. That's not what I said.
So, okay, so how do people find you? What are the ways they can get to you by? How can they get in touch with you?
Uh, my website, alexisfreddyb.com. I'm also on Instagram and TikTok at Alexis Freddy B.
Oh, okay, that's good to know. So tell us a nugget that you would like to share that most people would know that, or that you think should know but don't know.
Um, well, one of my taglines is the word vulva is not vulgar. To understand that teaching and expressing medically correct terminology for our bodies, and that being knowledge is in fact power. And when you know better, including when you're going into the medical field, when you're able to advocate for yourself because you know certain things about the body, can also empower you, especially as Black and women of color. It's important to really have that knowledge when you are navigating different areas of life, because we know just from statistics and research that there is a deficit there when you're talking about Black women and women of color, in all areas, not just the medical field, but in all areas in general. So to educate yourself and then to receive the empowerment that you may need. Also, to understand that sexuality is more than the first three letters. There's five circles of sexuality. So to just go through life thinking that sexuality is just about penetration or intercourse or sexual behaviors, you're missing out on so much more, and you're not addressing everything because we've been socialized to believe that sexuality and sex is something that should be whispered, or should not be talked about. And then you have the other end of the spectrum where we have the hypersexualization that doesn't truly bring in the intimacy part. It's all about, being able to just receive pleasure, or instant gratification, or manipulating or coercion, and not truly dipping into who we are or building connectedness with another human being.
Yes. Okay, thank you for that. Um, so anything specific you would like to promote to the audience around health, wellness, or the services you offer?
I do have a free intimacy workbook if you sign up for my mailing list through my website. It's a great place to start if you're thinking about building intimacy. I do talk about, I think within the workbook, maybe three of the different types of intimacy, um, out of the 12. I have a webinar that is coming up in July, which is prioritizing pleasure, part two, where we do talk about the different types of intimacy. I created a framework that is very easy to remember so that you can, I have also an inventory that you can take to see which pleasure type you may be, which type of pleasure, which type of intimacy is sort of like your primary type of intimacy. And then I talk about how you can go into and experience those both alone and with a partner.
Oh, okay. Very cool. Very cool. That is nice. So, I think that is all I have for you in terms of questions. Anything else you want to add or say that would finish?
No, just thank you so much for having me again. The intersection and the collaboration between pelvic floor doctors and sexologists is like peanut butter and jelly. Like they
Yeah,
they truly
exactly.
go together. Because I know for personally, I can't speak for, I know personally myself, I was never even taught the significance of different types of exercises or stretching that can enhance sexuality, even as well sexual intercourse, even if you're not going through the different type of disorders or discomforts, that there's still benefits and hip stretches and
Mhm.
and dilators and all the things.
Yeah.
So
Yes.
thank you for what you do.
Oh, thank you. Thank you. I appreciate your time for coming on and sharing your valuable information and all the good free stuff that's coming up. I hope the audiences take advantage of that and will find you. And thank you very much.
Thank you.
Yeah.